Now that Mark Tedford is the Republican nominee in Oklahoma's 1st congressional district, voters have a clear choice. This race is not really about personalities. It is about whether District 1 wants another vote for the Trump-Hern agenda or a representative focused on local results. Mark Tedford is a successful Tulsa businessman. I know him and his family. This is not personal. But campaigns are about policy. Tedford is not running as a break from Kevin Hern. He is running as another Trump-aligned Republican. So District 1 voters should ask what that means. Kevin Hern had real influence in Washington. He served on the Powerful Ways and Means Committee. He held Republican leadership roles. He had seniority. So voters should ask a basic question. Did health care get cheaper? Did schools get stronger? Did veterans get better access to care? Did seniors get lower drug prices? Or did Hern mostly vote the party line? Social Security is not charity. It is an earned benefit people paid into their entire working lives. When Republicans talk about raising the retirement age, that is a benefit cut. For Oklahoma men, life expectancy at birth is only about 71 years. For women, about 76. Raising full retirement age to 70 would leave very little room, especially for men. That may work on a Washington spreadsheet. It does not work for Oklahomans whose jobs wear out their knees, backs, hips, shoulders, lungs, and hearts. Prescription drug prices are one of the clearest examples of Washington choosing special interests over seniors. The VA negotiates. Insurance companies negotiate. Hospitals negotiate. Medicare should be allowed to negotiate too. The Inflation Reduction Act finally gave Medicare power to negotiate some drug prices, capped insulin for Medicare patients, and created a $2,000 annual cap on Part D drug costs. Republicans opposed it. District 1 voters should ask Tedford if he would stand with seniors or stand with the drug companies like Kevin Hern and the rest of Oklahoma's Republican delegation did. Before John Croizon built a successful business, he was a teacher and coach. Today, he serves on the Tulsa Public Schools Board. That matters because public schools are where most District 1 children get their education, meals, special education services, transportation, counseling, and help preparing for college or career tech. District 1 needs someone who understands public schools from the inside. Title I is not an abstract federal program. It helps schools serving large numbers of low-income students provide reading help, classroom support, after-school programs, and services students need to catch up. The proposed federal cut would reduce Oklahoma Title I funding by about $60 million. District 1 alone could lose about $24 million. That is not local control. That is Washington taking resources away and leaving local schools to absorb the damage. Republicans said the big beautiful bill would not hurt Medicaid. But the structure tells a different story. Oklahoma could lose about $209 million a year in federal Medicaid support, plus face about $30 million in new paperwork costs. People do not stop getting sick when coverage is cut. They wait longer. They show up in emergency rooms. Hospitals absorb more unpaid care. Rural hospitals get weaker. Tulsa hospitals get more crowded. That is not savings. That is cost shifting. District 1 has tens of thousands of people relying on SNAP, WIC, school meals, Meals on Wheels, food banks, and related nutrition programs. That is not waste. That is the reality of low wages, high food costs, and families living too close to the edge. When Washington cuts nutrition support, families pay. Churches pay. Food banks pay. Schools pay. Hospitals pay later. Calling that efficiency does not make it efficient. Republican candidates love taking pictures with veterans. But photo ops are not policy. Veterans need health care, mental health services, claims processed on time, cancer treatment, and toxic exposure support. When politicians cut federal staff and weaken public services, veterans can feel it too. A veteran waiting months for care is not helped by a campaign photo. District 1 deserves better than slogans. Here is the new Oklahoma math. About $209 million in lost Medicaid match. About $30 million in new Medicaid paperwork costs. $48 to $60 million in Title I cuts. $70 to $78 million in delayed or frozen education funds, and about $27 million in added SNAP administrative costs. That is at least $384 to $404 million in added costs or lost support. Washington claims savings. Oklahoma gets the bill. Mark Tedford should be judged fairly. But if he supports Trump's policies, voters deserve to know what that means. Does he support raising the Social Security retirement age? Does he support Medicaid paperwork barriers? Does he support SNAP cost shifts? Does he support cutting Title I? Does he support tax cuts that increase deficits and force cuts later? This race is not just about replacing Kevin Hern's name on the office door. It is about whether District 1 wants the same politics with less seniority or a representative focused on local results. Follow the money at langdon.substack.com.